Deputy Director of Nursing for Cancer across Mid and South Essex NHS Trust. I'm here to talk about the primary and secondary care interface. I think for virtual care reviews, it's really important for our patients that we look at integrating cancer care and the support we can provide to people affected by cancer. Next slide, please. So what do we mean? So primary care we know is the first point of contact for people within our UK healthcare system. It's accessed directly by the individual or their family. So it includes not only general practice, but our community pharmacists, our dentists and opticians. Secondary care is around accident and emergency, which is accessed directly. And we are unfortunately seeing a spike in people coming and being diagnosed through A&E. We also have planned care through the primary care team. But then people can also be referred on multiple referrals and a number of different pathways. But secondary care should be disease specific, and in locations normally include the hospital, but there are other community settings. And we also have tertiary care centres where there's highly specialised care, where we may do more complex cancer surgery, transplants, for example. And within cancer, we know our teenage and young adults, for example, our primary treatment centre is UCLH for our Essex area, and for sarcomas, it would be Stanmore. So for patients, that can be quite complex. It can really complicate their pathways, and it can mean lots of different people that they don't always know who to contact. So I think it's important that very much the virtual care reviews are about signposting and supporting, as Liz mentioned. Next slide, please. So the patient voice, I think starting with Marion and Lee was really important because it's who we need to be listening to. And people often feel that they're left in the dark, they're stuck in between. And I think that's what I often hear from looking after people affected by cancer, that they don't know always if they're under the hospital, whether they're under the GP. And I think we need to build very much going forward that we care for them as a system, and we continue to support them throughout. The National Cancer Patient Experience Survey showed that when asked if caring for people, they thought that we worked well together to give them the best possible care, the national average was 73%, which is a fair number, but I think it shows we've got some work to do. And I think what's really working well is we're looking at that co-production that we mentioned at the beginning. We're working with our local patient group to actually build our action plan for our National Cancer Patient Experience Survey, and I think that's really important that we listen and we hear that voice of what we need to do to work together. Macmillan and NHS England show that people not only just have cancer, but they may have a number, normally 2 or more long-term conditions. And again, that builds up even more of a jigsaw puzzle for people, and coordinating services and trying to find out who best cares for them and how they can best get the support they need. And that also means working alongside social care, mental health services. We've seen a huge increase in people affected by mental health, especially since the pandemic. And we need to ensure those services are all linked in with providing the best end of life care. And we know, and Macmillan have very much documented this, that vulnerable and excluded groups are at greater risk of their needs not being met. And that's shown very much through the National Patient Experience Survey as well, especially for people with learning difficulties and people from Black and ethnic groups. We need to do a lot more work to ensure that everybody's needs are being met. Some of the common issues that we have are our IT systems, that they're not interlinked, and there's lots of work being done to really improve our IT systems so that communication, and again, going back to the National Cancer Patient Experience, communication is one of the themes that really comes through very strongly, is that we need to improve that, and actually IT is key to that. to ensure that when there's changes in care, that we're notified. Then also people don't want to keep having to repeat their story. Actually, they want us to know what's going on and to be aware so we can support. And we don't want it to be system led, we want it to be patient led. So they know who to contact for advice and who is responsible for what. Next slide, please. So how can we ensure that best practice interface? And we need to ensure that working across all areas of care, there is that good communication, collaboration, and we've done a lot of work in training our nurse practitioners within primary care in learning more about cancer, so that we know people affected by cancer spend most of their time in the community, and we want to ensure they feel supported within the community. We need to build up good relationships and having that sharing of communication and embracing innovation. We know there's lots of work in personalized stratified follow-up, that we don't want to keep bringing back people to hospital unnecessarily, but that we want to embrace innovation and have the opportunity for people to manage their care. And we want clinical and non-clinical champions, and we're really striving to have our cancer champions that can really drive forward change in cancer care and telling us what we need to improve on, but also being champions in driving forward health improvements and health education to our population. And the benefits of this is that we know that it improves quality of care, it improves patient safety and experience, and it also gives us job satisfaction. If we have good IT systems, if we have good communication, and if we know we're providing a good service, that makes us all feel better that we're doing a good job. And we need to improve that NHS resource. There's lots of resource out there. I think especially with new roles coming into primary care, such as physiotherapists, pharmacists, we really need to link with this resource to really support our cancer community. Next slide, please. Liz talked about personalised care, and this is really key and something we're really driving forward in cancer, very much within the hospital, but very importantly wanting to drive that in primary care as well. And so that people can be active and empowered to plan their care and give the best care possible to deliver to them. And it's very much based on what matters to people. And if you look at the holistic needs assessment that Liz showed us earlier, one of the themes that patients tick most regularly and is the highest recorded measure on a holistic needs assessment, regardless of what tumour site people have, what cancer they have, what age they are. The thing is marked highest is always worry, fear, and anxiety. And I think that's something that we have to listen to and actually build a culture and build a team of people that are there to support that. And actually, we have lots of people that can do that, and that starts from even the receptionist in the primary care. In our primary care networks, through to the specialists, they all have a part to play in supporting that patient and making that journey better. We very much want to see an interface between all care providers, which is really pivotal to embedding that personalised care and providing high quality and very much timely, accessible care for patients. And that's important as well. People want a timely service that they can rely on, because it's a really worrying time. And I think around building it being patient led. I spoke to a patient yesterday who said, I'm so worried about losing my job because I have to go to so many appointments. And that fear is really, really strong. And we have to do as much as we can to support that and make it patient led. Next slide, please. So summary, so the primary and secondary care interface is really important. It's about putting the patient, the family, the community at the centre of everything we do, listening to what is important to people affected by cancer, sharing that decision making and ensuring it's personalised. So thank you, that's all from me. I'm going to hand over to who am I handing over to?
You're right.
Sorry.
Thanks, Emma. Thanks, Emma.
Thank you.
No, thanks very much for that. I very much like your jigsaw and analogy, and it's a challenge for us of fitting all the bits together, because the vast majority of the time they really don't, to patient detriment.